This is Derek Haas with Conceive Fertility Center, and today I'm going to show you a surgery that we do called a tubal reversal surgery. And so this surgery is usually done when a woman has had her tubes ligated, so for contraceptive purposes, but then has gone on to regret that decision. And it's been shown that about 1 out of every 5 women under the age of 30 who have a tubal ligation go on to regret that decision. So what we need to do for that surgery is we basically have to reconnect the two parts of the fallopian tube. There's a proximal end and a distal end that have been interrupted. And so I brought some props with me here today. So the pencil is about the width of the fallopian tube, and so I've just kind of got some tape here to represent the scar tissue. So the first thing we have to do during the surgery is actually remove that scar tissue and take that off. Okay, and then we have to reconnect these two parts of the fallopian tube. So it's pretty small. And so because of that, we need to use special glasses called loupes. So I'll show you what those look like. Okay, so if you ever want to find out how bad your nails look, you look at your nails under these things, and they'll show you. You'll see. But the suture that we use is about the width of a human hair, so that's why you need something that can really zoom in and show you exactly what you're doing. So once we get that completed, we have an instrument inside the uterus that we can push blue dye through, and we can confirm that we've actually successfully reconnected the fallopian tubes. Now, some things to remember are that prior to surgery, there's a couple things that we like. So we want to have the operative report from the tubal ligation surgery, because we want to find out if something called a distal salpingectomy has been done. So if this end of the fallopian tube has been completely removed, probably this is not the best approach to get you pregnant, because the distal end has these finger-like projections called fimbria, and those are very important to reach out and pick up the egg. So if a distal salpingectomy was done, then this is not the right approach for you. The other thing we like to have is a semen analysis, because we need to know that your male partner actually has sperm to work with. If he has a very low sperm count, then IVF would be the better approach for you to get pregnant. Some post-surgical considerations are pain control. So usually the patient will have to use 1 or 2 days of oral narcotics, and we also use some lidocaine strips above and below the incision. And finally, the patient will need to be off of work for about 1 to 2 weeks. And lastly, when you get pregnant after a tubal ligation, you have to go see your doctor immediately, because we need to follow your pregnancy hormone levels very carefully, because there's always going to be about a 10% chance of the pregnancy being ectopic or being lodged inside the fallopian tube somewhere. So as long as we follow that closely and catch it early, we can give you a medication to stop the pregnancy and prevent a surgical emergency. So anyway, that's it for today. This has been our web series learning about tubal reversal surgery. I'm Dr. Derek Haas with Conceive Fertility Center, and I'll see you next time.